Have you ever been in a situation where you broke an endodontic file inside of the canal and you don't know what to do next? Well, welcome to the Diary of an Endodontist. I'm Dani Mancuso, specialist endodontist and prosthodontist, and I'm going to show to you 3 different clinical cases what to do in those situations. Stay with me. As soon as you break a file, what happens to your face? It changes completely. First of all, your eyes wide open and then you just panic. It's quite normal to feel like that and to want to cry or to hide yourself. But what I normally say is that if you haven't fractured a file before, it's because you haven't done enough endodontic treatment in your life. First of all, try to understand where you fractured that file and see what you need to do to either remove it or bypass that file. Believe me, if you remember that case that I showed you in episode 7 of the Diary of an Endodontist, that file was not retrieved and we couldn't even bypass it. But with the correct disinfection, if you disinfect it properly, if you do everything in stages according to the protocol, you will be able to save that tooth. So you can see the file over there is still over there and you can see a lovely healing. There are other situations like this one that you fracture a file at the coronal third of the canal. This is a lot easier to remove and is more predictable. Sometimes you need to balance whether it's better to enlarge that canal to retrieve that file, or if it's better just to bypass it and just bury that file inside of the canal. But no matter what you do, no matter what happens to that file where you fractured, just stay calm and tell your patient the truth. Remember that the patient deserves to be told the truth. If you retrieve the file, amazing. If you leave it inside and either bypass it or just leave it inside, make sure you do reviews on that case. Make sure you are looking after your patient properly. And remember that although sad, it's not uncommon to fracture a file, and it's not negligence to fracture a file. But not telling your patient that you did that, this is negligence. So stay tuned for the next episodes and don't forget to subscribe.